Chronic Wasting Disease Sample Collection. Warning: images in this video may be disturbing to some viewers. No animals were harmed in the making of this video. Deer parts were provided by a meat processing plant. This video is intended for training purposes only for veterinarians and animal health professionals. Step 1. Obtain supplies. Step 2. Personal protection. Step 3. Remove animal's head, collect obex.
To remove the head on the white-tailed deer, have the deer up on its back. If you cut the neck off, so you've got some neck attached to the head, then you can do it that way also, but it's easiest if you can remove the head while it's still attached to the deer. And the landmarks that you want to look at is going to be the base of the ear and the curve of the jaw, and behind the Adam's apple, when you grab that, the larynx and pharynx right there, you want to be behind that. So that's kind of your landmark. And to know that you're in the right spot, because you're going to want to take this head off at the atlanto-occipital joint, so the last joint from the spinal vertebrae to the head, to the back of the skull. And so the way you can check that is to move the head up and down while it's attached to the body at your yes-no joint. And where that's going to bend is right where you need to take your knife down to cut that head off. If you are too far back and get back a joint, you won't be able to get to where you need to remove the obex, the part of the brainstem that we need to get. If you're too far forward and angle your knife from here back, you could slice off the retropharyngeal lymph nodes, and then you won't have those for sampling, or you'll have to go find them attached to the other part that you just cut off, which makes it a lot harder. So if you use your landmarks, curve of the jaw, base of the ears, move the head and go straight down, you should hit these occipital condyles, the base of the skull. And when you get down to that, then you're going to have some tissue covering those, but you'll feel them with your knife. Then slide your knife underneath that and cut the tissue until you see the opening, the foramen magnum that houses the spinal cord. And so once you can see that, and you can keep checking to make sure you're in the right spot, the right joint, then you've got that the joint comes and it kind of encapsulates the other side like this, and you've got lateral collateral ligaments that hold that joint in place, and you want to take your knife down and cut those when that joint's attached. And once you cut those lateral collateral ligaments, then it'll open up that joint space even more. And you can press down a little bit on the head and open that joint up. But at this point, you don't want to just break the head off and tear and pull your joint open, because if you pull and tear that spinal cord, it'll sometimes tear or rip too far forward, and then you can't get it out. You need to, when you have this joint open, as soon as you can see your spinal cord and you can get in there, you angle your knife as far back toward the body of the deer as possible, and you cut that spinal cord. So you put your knife right in there and you cut right through there and you cut that spinal cord, and then that's what it should look like. You should see the cut portion of the spinal cord. And once you have that, then by whatever means you need to, you can go ahead and take the head off. You can even leave the body attached as long as you have it laying open, and you can get your sampling done. But the main thing is don't twist the head and pull it around and just let it tear. And also, you don't want to have the head really bent back and it really bent open when you cut that, because if you cut it and there's a lot of tension on it at the time, then that can slide back in there because you've had so much tension. So you don't want to have a lot of tension on the head when you cut that spinal cord, and so that you have enough of that spinal cord left to be able to hang on to it when you actually do the sampling. The next step in the process is to remove the obex, which is a part of the brainstem. And you can actually see the part that we need. There's a little V right there. It's way shadowed in there. But my point is, it's not that far in there. And so you don't have a lot of room to play with. So you want to be careful with getting your brainstem out. And when they're in good condition, it certainly makes it easier. So the first thing we want to make sure that you understand is this tough connective tissue that surrounds the brainstem, the dura mater. You have to be inside that dura mater. If you're on the outside and start trying to pull out the brainstem, because sometimes this dura mater sticks a little closer to the brainstem and the spinal cord, and if that happens, you can get on the wrong side of it, and if you're trying to pull this out, you will make a mess and it will never come out. So sometimes I'll trim that up a little bit just to kind of make sure it's out of our way and to show that we're where we want to be. And we'll just trim some of that off of there. And that goes around the entire brainstem. That down there's pretty good. The other thing is you can see these little bitty connective tissue threads that come in right there and attach to the brainstem. Those are the cranial nerves coming in, and they come in on both sides of the brainstem. We have to sever those connections or they hold that brainstem in there and make it difficult to remove. So when you grasp your brainstem, if you just keep coming at it and grabbing it like this, eventually it can break it down and tear it apart, and then you'll have just mush. You won't have anything left to hang on to. So when you grasp the brainstem, try to come at it a little bit from a sideways motion and be very gentle with it, and slide your scissors in, keeping them to the outside, and you can open them slightly and just cut those cranial nerves. And there's other connective tissue also that connects this bottom part to the cerebellum underneath it, and you need to remove all those connections, and you can kind of feel it give and release a little bit as you poke your scissors in and remove those connective tissue attachments. So you want to make sure you can go all the way around without any resistance, because some of those are in there a little bit deeper. Like, just felt another one in there. You can kind of feel those give way. And once you feel like it's pretty loose and you believe you have it, then you're going to want to use your sampling spoon. And when you go in with your sampling spoon, you go in on top and you hold it up and you go down. And what you're doing then with the top of it is you're severing the spinal cord down past what you want to pull out. So you go in, you go down, and then you just kind of, it's just a side-to-side motion. And you can gently tug the spinal cord while you're pulling it out, and it should come pretty easily. And that's the brainstem. So the obex part is actually from this V section right here. You can see a V right there. And from a couple millimeters below the V to about a 9 millimeter swatch, about like that, is actually the obex, the section that they want. But that's, if you have a lot of extra, if you pull some of the cerebrum with it, you might want to cut that off, but if you get this much, that all goes in your formalin jar.
Step 4. Collect retropharyngeal lymph nodes.
The next step in the process of CWD sampling is to collect the retropharyngeal lymph nodes. The retropharyngeal lymph nodes sit above the occipital condyles, below the trachea and esophagus, and above the muscle hunks that are also sitting right there above the foramen magnum opening where you're at doing the sampling for the obex. And they sit to the inside of the salivary gland. So most of this tissue over along the lateral side is salivary tissue. And you can tell the difference on the salivary gland. The salivary gland has a more cobblestone appearance to it, and if you cut it, it's cobbly, more like clusters of grapes, and it's not, you can see the little clusters like that. It's not a homogeneous texture like the inside of the lymph node is. Sometimes you can see the capsule and the medulla with the lymph node, but that's the different salivary gland, and that sits on both sides, and the lymph node tucks kind of up under next to that. So you got to be careful not to get salivary gland when you're looking for lymph node. The other thing is you can sometimes put your fingers in the divot of the area where I showed you, and you can sometimes actually feel the lymph node sitting down in those pockets when you're looking for it, and they're going to sit a little bit lateral and tuck up next to the salivary gland. And the lymph node has a capsule on it, so it's going to kind of give a smooth, glistening appearance when you're looking for it. And there's one on each side. And they tuck down in here, so you're going to have one down in this pocket also, tucked up next to the salivary gland. And so I like to use my scissors and kind of dissect down to the lymph node till I see that capsule, and then grab a hold of it and dissect it out. Some people like to use a knife to get the retropharyngeal lymph node out. There'll also be lymph nodes when you're taking the head off. You may see lymph nodes sitting kind of right on top of right underneath the jaw, right after you skin it. Those are submandibular lymph nodes, and those are not the lymph nodes that we're looking for. You're going to find, the reason they want the retropharyngeal lymph nodes is for chronic wasting disease. You're going to find the abnormal prion, if they have it, in the highest concentration and the earliest in the retropharyngeal lymph nodes. And so that's why that's the lymph node that we want and not the submandibular. So you can see this lymph node's kind of starting to pop out at us down here. They're typically a tan in color, but they can be hemorrhagic in color. They can be red. They can be purplish in color. But most of the time in a healthy deer, they're tan. And you can kind of, as you hold on to it, peel it out. You can grab it a little harder, especially with the connective tissue around it, than you can the brain tissue. It is a tougher tissue. And so you can hang on to it and work it, kind of peels out of there. We'll take a look at it here once we get this one out. Now if you get a lot of extra connective tissue stuck to it, to the lymph node, you can kind of trim that off before you put it in the formalin jar. And you can see it has a distinct feel to it. It's very, it's not kind of just lobulated and hanging out there like the salivary tissue. It actually has that capsule. Now to make sure the formalin gets all the way down to the center of it and that it gets fixed well, because we're going to put these tissues in formalin, you want to just what they call bread loaf it and do a couple slices about halfway down to the center of the lymph node, and that'll let the formalin get into the center of the lymph node. So that's our left one, and then we've got one more to take out then on the other side. The other thing to kind of mention is on these lymph nodes, they can be several different shapes. That one was very typical, kind of a kidney-shaped lymph node, but sometimes these lymph nodes, though, they can be even bilobed. They can be, I've seen them heart-shaped. They can be circular, just kind of round, more like a sphere. And they can also be different sizes. If the deer has been sick or stressed at all, they can be enlarged and reactive. If they're real watery, or if you find pus, abscesses, granulomas within the lymph node, that's something you might call the Board of Animal Health and ask about, and we can come take a look at it and see if it's something we need to send off. We are always looking to make sure we don't have TB in our deer. But the older the deer gets, the smaller the lymph node becomes. This is a pretty typical size lymph node on a 2-3-year-old deer, which is what I would guess this buck was. But on older deer and elk, the lymph node can be the size of a pea. It can be very small, and it's much harder to find. And so again, we have kind of a oblong, somewhat kidney-shaped sized lymph node. Cut off some of the excess connective tissue off of it. And then we'll make some horizontal cuts halfway down. Make sure our formalin gets to the middle of the lymph node. And that gives us a good way also to kind of take a look at the lymph node and make sure we don't have any abscesses or granulomas within it. So all three of our samples, our lymph node and our obex, then will go in a formalin jar. And the formalin is a 10% buffered formaldehyde solution. And so it is caustic, considered carcinogenic, so you don't want to get it on you. If you do, you want to wash your hands well, and you don't want to get it splashed in your eyes or anything like that. It would be dangerous.
Step 5, Official ID Collection.
The next thing we're going to talk about is official ID and packaging and getting our samples ready to ship. So as far as the identification that needs to go with the sample needs to be sent with an official ID. Official ID is going to be the ear tags that either are a 15-digit tag that starts with 840, which the 840 stands for U.S. origin tag, and they've got a 15-digit ID. Now the 840 tags, 840 tags, can be in several different styles. They can be a button tag. They can be a button tag with a bangle. The 3 to 4 digit number that's on the bangle part of the tag, that is a management number. So the official ID is the 15-digit number on the button, and then the management ID that can also be used for identification. This is a type of shearwell tag. It's also an 840 tag. It's a clip tag that goes on the outer edge of the ear. These tags, the buttons tend to sit more in the cup of the ear. And then this is also an official ID tag. The 840 numbers along the top, and then the large numbers that are more visible is a type of management ID. So the 840 tag, and then the metal noose tag, which is a metal clip tag that goes on the ear. All of the official ID tags have to have the U.S. shield on them, and these would also. And these start with the state code, which in Indiana is 32. So most of these tags that you'll see in Indiana will have a 32, then 3 letters, and then 4 numbers. And that would be written as an example, 32 WMD 0012. And that's the metal official ID tags. So for the sample to be sent, it has to have an official ID. If the deer that you're sampling has lost its official tag, then you need to replace it with one of yours and make a note in your records of what the new tag is that got submitted with the sample. Or if you're collecting samples, if you're a veterinarian or collecting samples for somebody else, if you're a certified collector, then have the producer get you a tag before you send it in. They need a replacement tag that they will put in their records that goes with the sample. And then all the tags should get sent with the sample, but they have to have an official tag. And then the other tags are just farm tags that go with the deer. On the official tag, we want to send about a quarter size piece of ear tissue around the tag. So we want that to go with the tag, about a quarter size piece of ear tissue, attached with the tag still attached to it. Now we don't have to have that on the farm tag. This is just a farm tag. We do not have to have that. The reason that they want the piece of ear tissue is if we would have a positive, they can use it for research, they can use it for genetic sampling and DNA, and they have to have fresh tissue for that. So our ear tags and our ear tag with a piece of ear tissue is going to go in its own separate sealable bag. And on the bag, we want to label it with the date that you're collecting the samples. And then the producer's name. So let's use my name. So date, name, and then the ID tags of the animal. And the whole number, 840-003. 000-272 836. And then if you had a management number with it also, you can put that below the 840 number. And then the farm tag, those tags have an Indiana cervid herd ID, the IN 841 dash, and then the bigger number we put a dash, and then that's an individual ID, and that would be the farm tag. And so we want to write all the IDs down, but we only have to take a piece of ear tissue with the official ID. So this tag would go in the bag. And then our official tag, and these are wild deer heads we're practicing on, so the tags are not attached, but we're going to pretend that they are. And we're going to cut a piece of ear tissue around the tag, and then that also would go into the bag. Now, with sending the ear tissue, you don't have to send an ice pack with it, but they do need to get sent to the lab within a day, 2 at the most. Anything sent to the diagnostic lab, Purdue University in Indiana, as long as you send it UPS, will get there next day. And so that's the easiest and the cheapest way to ship it, would be to ship it UPS. And you don't have to pay extra for next day if it's going to the diagnostic lab from anywhere in Indiana. So this will be your fresh tissue bag that'll go. And then your formalin jar that has the samples that we put in it, you also want to label it the same way. A lot of times we recommend you label the jar, but you also can label the lid. Sometimes, just in case the lid would ever get separated from the jar, it's nice to be able to see it from the top, what the numbers are. But you want to make sure you label your jar also, in case the lid would get separated. So we label the lid, and then we also label the jar. And you don't have to use the sections that are listed on the formalin jar. You can just, the date's nice because it's there at the top, but then you can just put the name and your ID wherever you can on the jar. And so you've got the name, date, and the identification on the jar.
Step 6, Submission Form. Make a copy for your records. Submit form with samples. Step 7, Packaging samples.
Next, we're going to talk about packaging the samples to be able to submit them to the diagnostic lab. And so here's the samples we just took, and you've got your name, date, and the identification, the IDs from the ear tags. And we've got our formalin jar and our fresh tissue. And the formalin jar, you put it on as tight as you can, and then you put electrical tape twice around the lid, because no matter how hard, how tight you put that lid on, they still can leak formalin, and because it's considered a caustic carcinogenic substance, we don't want to have any, we want to prevent as many leaks as possible. So we electrical tape the formalin jar, and then to put it into, you have to put it into 2 Ziploc bags. We put some paper towel underneath it so that if it leaks, it has the paper towel to absorb any of the formalin, and it doesn't drip. And we leave a tab on the electrical tape for the lab to be able to grab it to unwrap it, so they don't have to dig along and try to find the end of that electrical tape. So we put a tab on the electrical tape. We put paper towel under, or some type of absorptive material underneath the formalin jar. And then we put that into a Ziploc bag, and we seal that. Try to get as much air out as possible. And then we double bag it into a second Ziploc bag. And that's how our samples, that gets submitted. And then our submission form and the payment to the diagnostic lab goes in another Ziploc bag. So we have 3 bags, quart-sized bags, and then we put all 3 of those into a gallon-sized bag for shipping. The payment, the checks are made payable to Purdue University, and for a formalin jar right now, the amount is $37. That could change, it hasn't for quite some time, but for right now it's $37. 1 sample per submission form. You can write, like if you're sending 3, if you sampled 3 deer heads, you can write 1 check. You can just take the 37 times 3. 1 check made out to Purdue University. And then these 3 bags get put into a gallon bag and then put into a shipping container of some type. You do not need to send an ice pack, but they should get sent so that they go overnight. But as long as you do UPS, they will go overnight to the diagnostic lab from anywhere in Indiana.
Step 8, Shipping information.
The shipping address that the samples get sent to is the Animal Disease Diagnostic Lab. You can abbreviate it ADDL, 406 South University Street, West Lafayette, Indiana, 47907. And the samples should be shipped to the laboratory within 7 days of death.
Step 9, Biosecurity and Decontamination.
The final step in the process is then cleaning and disinfecting your equipment and the table and the surfaces where you've been working. You can use an undiluted bleach will work, a 5% bleach solution, or a Virkon. Any really general cleaner to clean up is going to work, since there isn't really a disinfectant that will kill the prion. But you want to clean the blood and tissue off of your equipment. So we pour water here into our bucket. We've got Virkon that we put in there, Virkon powder. And then we'll clean up our equipment with that. And the main thing that we need to do is make sure you dry it really well after you clean it. with some paper towel, because you don't want to, especially with the bleach or any of it, you don't want to leave the liquid sitting on the equipment, because it will rust the stainless steel. And so we're getting a brush here to clean up our equipment. And once we have that done, we'll dry it good and lay it out. And then also on the table surfaces and anywhere that you may have contaminated when you're doing your sampling, you can also use this water and this brush to clean that. Sometimes the floor, definitely the table surfaces if they weren't covered that you've been working on. And then the coveralls that you've had on for sampling, you want to wash those before using them again. And just hot water and laundry detergent works fine for that. You want to make sure you open up your scissors and get any blood and tissue that may have collected clean good out of those, and also out of the inside of the rat tooth forceps. You want to clean any blood out of those good too. But not least our sampling spoon. Once we have those cleaned up, then we just want to take paper towel and make sure we dry them off good before we put them away. Usually let them sit out to air dry just a little bit, even once we dry them off. So bleach, Virkon, really any disinfectant will work that way. And then wash your coveralls and change gloves before you go on to your next sampling.